You know, I have to say that when I was a medical student here, I never really thought that I would be practicing medicine or retiring or living here. Didn't really see myself coming back. And now, having been here for a while, the pace of life is wonderful. The hospitality and people are wonderful. And this setting is just so incredible. I'm originally from California, and I originally went to undergraduate school at UCLA. At that time, even from the beginning, I was interested in medicine all along. So I applied to South Alabama. I've been very grateful for the education and the opportunity I've gotten. After I graduated, I went off to do residency in the state of California, my internship and residency. And what I came to appreciate in the course of those experiences was how incredibly well prepared I was as a medical student clinically. And I had much more experienced and advanced clinical skills than the average interns I was working with. And then the first position I took as a faculty member was at Case Western Reserve University in Cleveland as an assistant professor. I was discussing with the dean about emergency medicine, and I noticed that there was no emergency medicine residency program at the University of South Alabama, and so he asked me to come in and do a consult, kind of an analysis regarding the potential for academic emergency medicine at South Alabama. And that report was that it's absolutely needed. It's a great place for it. It's a perfect training location with the populations between the Children's and Women's Hospital, the pediatric emergency population, the Level 1 Trauma Center. All the pieces were there to have a great emergency medicine residency program. So they decided to engage in a new chair search. And then Dean reached out to me and asked me to apply as part of that chair search. And at that point, my wife and I had been talking about what to do next, and the timing was just about right that my youngest child had graduated from high school and had left the house and gone off to college, so we were empty nesters. The thing that really, I think, clinched it for me was how often in life do you get opportunities to really build things, really develop, not just maintain, but build programs and have a major impact, if not be transformative, for emergency medical care in a region, and at the same time give back to your own alma mater. It was a big, huge move for us, but it's been some of the most enjoyable, rewarding professional work of my life, I would say. So I've been here just over 3 years now. So I started as the new chair of emergency medicine back in the summer of 2015. When you take a look back at the last 3 years about the number of new emergency medicine faculty that we've hired, about taking the evaluation center at Children's and Women's and transforming it into a true regional pediatric emergency department, of setting up new divisions of pediatric emergency medicine, of getting the faculty together to submit for residency applications, and then involved in fundraising and organizational efforts to rebuild the emergency department, the trauma center. For having all of that going on in 3 years at an academic medical center is pretty astounding. I feel as if the entire health system is really moving forward, expanding and taking off in a very positive direction. And to the extent to which I can be part of that at the institution, and to the extent to which emergency medicine and the emergency departments can be part of that growth, well, that's wonderful. So I've done several episodes of the show for many years. Started while I was in California, and I met the people that had started the show, and they were asking for stories, so I gave them stories. And after I'd done a few episodes, the joke that was always said about me was, I am an emergency physician, and I play one on TV. You know, kind of turn that joke around, that I'm not a real physician, but I play one on TV.
This award to him is, he's won a lot of other awards, and this is the one that means the most to him. And he works really hard. He is good at what he does. You know, I'm very honored that he's won the award.
Knowing that you have that impact, growing those programs, transforming emergency medical care for this region and producing physicians for this area is the reward itself. I mean, that's the reward, is to see the fruits of your labors and to know you really are having an impact. The fact that I'm recognized by peers and by the university for doing that is wonderful. I am just remarkably, astoundingly grateful.